comprehensive mental health program. So we do provide, and we work with our resettlement agencies and our partner agencies, and we don't just provide therapy, but we also work on preventative care. We work on the wraparound model for those who do come to our doors. And on the higher level, we have programs that help break the stigma of mental health in our community too, which I think is the #1 barrier to people actually seeking mental health. I think what I would say is that I would encourage everyone to come to our table and answer questions. I also want everyone to take a trip at some point to the Arab American National Museum, because it really kind of talks about the larger message. If we want to showcase what Arab Americans and what refugees have done in this country and in this community, and really supporting programs like that brings the message to a whole higher level, and it helps the advocacy piece. Thank you.
Hello everyone, my name is Kaula. I am the International Services Lead at the American Red Cross, Southeast Michigan. Thank you all for what you're doing to the Syrian people. I want to start by saying that the Red Cross and Red Crescent movement is trying to help millions of Syrians every day in and around Syria by contributing food, money, and providing shelter, water to everybody. And as part of the international movement, the American Red Cross is trying to contribute and distribute money, and also send some disaster specialists to around the Syrian country to help those efforts. I want to talk about our Restoring Family Links program. Basically, it reconnects families separated by war or disasters. We try to do whatever we can to find the missing person and reconnect them with their loved ones. Our Southeast Michigan chapter is the second busiest chapter in terms of restoring family cases. Basically, our caseworkers try to take the information from the clients, and after that try to work with the ICRC, which is the International Committee of Red Cross, and the UNHCR and national societies, including the Syrian Red Crescent, in order to provide all the information they need. Some of the services we provide is providing Red Cross messages and certificate of detention. Basically, this is the certificate that shows that you were in a certain camp, or a tracing request, etc. I want to share one of the successful stories that we had in Southeast Michigan. It's the story of Hisham. Hisham is a Syrian who moved from US back to Syria to be with his ailing family members. His ex-wife and his 3 children were in a constant communication with him until they received the last email from him, stating that if they didn't hear from him, he probably was killed by the fighting taking place in his city. His family in the US tried to contact him desperately for a long period of time, but with no luck. His ex-wife, came to the American Red Cross Southeast Michigan chapter in hopes that the American Red Cross can help her. In just 3 days, after working with the ICRC, UNHCR, and the Red Crescent in Syria, we were able to locate Hisham. He was well, alive, and safe, but he was unable to contact his family because the network was down almost all the time, especially for calls from abroad. His family was extremely happy. You can't imagine. Hisham's story is one of many stories of Syrians trying to locate their beloved ones in Syria. The amount and level of concern every Syrian has to deal with every day when they lose communication with their beloved ones is unimaginable. Despite the fact that not all cases is accepted by the American Red Cross due to the fact that the ICRC, which is the International Committee of Red Cross, can't actually go to some areas in Syria right now due to the fight, basically. The Restoring Family Links teams are working very hard at all times to connect Syrians with their beloved ones and beloved members, whether when they are trying to locate someone or to send a message to someone, even if they were in jail. Our international services team wish actually to work with all of you, all the representatives in the agencies, also everybody in Southeast Michigan, whether you're working in a resettlement agency or not. We wish to expand our services, and we actually ask you to come to our booth, to take our survey, to tell us how we can do more to help Syrians, how we can help you, how we can send donors to you, maybe how if an American family wanted to host a Syrian family, we can refer this family to you. What things we can do for you, we will be happy to provide it for you. I am alive. These 3 words may be all that is needed to ease the minds of a distraught loved ones. Have the word away. Restoring family links can probably be that hope. Thank you.
Hello everybody. My name is Hassan and I work for the ACC, the Arab American Caribbean Council. Looks like we all one family. Everybody knows our agency. We've been here for 40 years, near 40 years. We have 40 offices, and these offices are all over in different counties. You can go to Detroit, Macomb, Oakland, and Wayne County. With me today, we have 3 people here, 4 people. We have Dr. Zafar, he can answer questions for you. And we have another project director. Here's Dawood, is going to ask, he can answer questions for you. But you can tell you more about who we are, what we do. From my perspective, as a director here for the job placement, job education, I always tell the people here that came from Syria or Iraq, never leave one rock unturned. You guys need help, and we follow certain steps in our life. In the 4 phases, planning, organizing, staffing, and controlling, we all have to have these 4 steps in our life. We can do, we can show, and we have to find out the proof, what we can do here. The agency, again, as I said, led by Dr. Fakuri Haifa. She's our leader, and she's been around for a while. With these 40 offices, we're all over, like in the HS offices, people there from the ACC, they can speak the language, and they can translate the language for you, and they can help you in every way they can. The program that the ACC has, we can break it down to 3 or 4 layers, get into technicalities. We have the physician, which is run by Dr. Obi, and also we have psychiatrists. They're also in different counties. If you go to Wayne or Oakland or Macomb, and we're all over. So we're all here that we can help each other. For jobs, we all know those refugees that come here the first month, the second month, the second year, the third year, they're going to live in pain for 5 years. And those 5 years are going to be the best years that they ever lived. They can go back and look and see exactly what they went through. And they can tell their kids, his kids, and their own kids. So they are, I can't tell you the pain and all that, as you heard from the peers on our left, as they said so many things about the life that they are going through. From an education point of view, we have issues maybe with certain visas. There are certain corporations that actually would apply for different educations for skills and knowledge that these refugees have. We can break it down. The program here that ACC has, from my perspective, reading, writing, being able to speak in interviews, we do help in all these phases. But before we can go into this program, I'd like to bring Zafar here to shed some lights about the physician side of his that he has done in the past and the number of people, refugees that he has served, actually, in our community. I think I left you some juice here.
Thank you. Good evening. My name is Dr. Zafar Abed. I'm the ACC Primary Care Clinic Director. We have our clinic in Dearborn. I'm going to talk about the ACC Health Assessment Program. We have actually 3 clinics, in Dearborn, Macomb, and Macomb County, and Oakland County. So I'm going to talk about our clinic. With me here is Dr. Haidar Farah. We work together in the clinic. So ACC Refugee Health Assessment Program has seen nearly 10,000 clients since receiving the program in January of 2012. We are at the ACC Community Health Center located in Dearborn. We have been serving the refugees who settled in the Wayne County area. For the past few years, we were only serving the Iraqi refugees. However, this year we started serving refugees from Syria. As you can see from the form I'm going to show you next, we are required by the state to do full exams, blood tests, immunizations, administer TB tests, vision exam, oral exams. Also, our exam includes mental health evaluations and screening. The purpose of doing all these tests is to screen and treat communicable diseases, diagnose and treat chronic diseases. Most of these refugees come from overseas with different brand medicine. We help them to switch to the medicine that is available in this country. We also help them with referrals to the specialist if needed. The most important purpose is to introduce to the refugees to the new American system, which is totally different from the system available in the Middle East. So this is the form that we have to fill. It's 3 pages. It includes all the physical exam and immunizations and everything, the medicines and everything. I'm going to talk today about a sample about the Syrian refugees. Since September of last year, we saw nearly 90 patients. Before that, we're seeing the Iraqi refugees. Half of these refugees come from the city of Homs, and the other half comes from the city of Daraa, which is in the south of Syria. Almost all of them fled to the northern part of Jordan before coming here. 46 of these refugees are adults, and 54 are children. It was very common to see hypertension, musculoskeletal pain, diabetes, asthma, defective vision, all the other chronic diseases. Also, it was very common to report depression and anxiety, but it was more common to see certain physical diseases that have a mental component. They are derived from the stresses and the strains that these refugees have sustained in the last 4 years. These disorders fall under the term psychosomatic disorders, and it means by definition the illnesses that do have a clear physical basis, but psychological and mental factors also play a role. I'm talking here about gastritis, headache, irritable bowel syndrome, teeth grinding, musculoskeletal pain, fibromyalgia, and hypertension. They were very common. And we broke the numbers down about all these diseases, about these 90 patients. So we made schedules for our own research in the clinic. In conclusion, the refugees come to this country bearing not only the burden of their physical and mental illnesses and an experience of a life of hardship and suffering, but also the burden of providing to their children and families in the new land with all the involved hardship. Our role is to work collectively to help them and to support their needs. Thank you. I just want to say one thing I noticed, and all the agencies can help. The main issue for these refugees is transportation, and I'm talking here beyond the 90 days that the agencies here have to provide. So if anybody can help these people with transportation, this is what they need really, and it is needed really. Thank you.
Thank you, Dr. Zahir.